Hi, everybody. This is Erica Mello, and welcome to episode number 140. And this is a shorty week for Susan and myself. So this episode is actually on how to increase proprioception, or I would say even better, the clues or the keys to increasing proprioception, or creative ways that you can increase proprioception. So it's at the end of the day, it's really not just about a balance pad or sticking somebody on a foam pad or a dynadisc. That, is outdated in my opinion. And this episode discusses various ways that I use proprioception and increasing proprioception to improve performance, whether it's performance for a patient just walking down the street or performance with, somebody in a sports related activity, running, tennis, golf. It could be whatever. And I think for me, I think that's a really important concept as you start to treat patients who, it doesn't have to be the tough to treat patients. It could be patients that have had surgery or who are just generally, they don't know how to sort of access their body in space. And for those of you who don't know, I'm actually in the middle of doing my doctorate right now, and I'm doing a research project right now on postural kinematics in equestrians and horseback riders. And I actually treat a couple in the office. And in one of the research pieces that I came across, it was interesting to note that the equestrians, the elite horseback riders, the elite equestrians, show jumpers and dressage riders, actually, their proprioception increases with their eyes closed. They do better in an eyes closed situation versus an eyes open situation, which goes to show you that can be trained and trained well. Okay, so you're just not going to, add proprioception, to everybody's program, although it would be nice, but I know we do have time limits and visit constraints, right? So you want to really think about, is this what your patient needs? I talk about an episode that Susan and I did a while ago, and this guy came in with every single problem going, and it was just constantly, every region of the body was bothering him. And I think he absolutely was a candidate for this type of treatment. And, my equestria that I am treating right now, she absolutely needs this. And because we're on a moving object like a horse, right? So it's important that you have to sort of ask the clinical question, right? Is this what your patient needs at this point in the program? So we hope you enjoy it. And for any new listeners to the podcast, welcome. And Susan and I have updated our website, and we have on toughtotreat.com. And for those of you who haven't sort of opted into our newsletter, we do have Clinical Pearls PDFs that we sent out, and we also have amazing sleep tips and persistent pain that Susan wrote. So for those of you who are new to the program and new to the podcast, go on our website, toughtotreat.com, and take a look. And if you would like those Clinical Pearl PDFs, just pop in your email and we'll send it off to you. And if you have any questions about a topic that you would like us to get covered, feel free to email us or just type in the search bar, whatever it is, like pelvic girdle pain, shoulder pain, stress urinary incontinence, foot pain, whatever issue it is, shoulder impingement. There will be an episode most likely that we've done on it. So, and if your answers are still not answered, or your questions are still not answered, feel free to drop us a line or reach out to us on social media. And thanks again. Hope you enjoy. Hello, everyone. This is Erica Mello, and this is a short little episode on proprioception. And I know that, or how to increase proprioception, right? And you could spend hours talking about this. And there's been so much research devoted to how to increase proprioception in athletes and also in the neuro population. So this episode is really about increasing proprioception in your orthopedic patients, and that can include athletes, of course, right? So it's not about, in my opinion, getting on a Bosu ball or getting on a foam pad, those AirX pads, or getting on a dynadisc. Those do have their place in rehab, especially for people who have balance issues, right? And some of more of your neurological population. But in terms of your orthopedic population, these types of instability trainings or sort of balance trainings haven't really been proven to outperform other types of stability training or training with resistance. So I'm going to use this as a patient example. And for those of you who have not listened to an episode Susan and I did, the podcast episode was number 60 on a patient of mine where he came in and everything hurt. One day it was the foot, one day it was the back, and then the hip and the other side of the back, the neck. It's, I actually, ironically, I have issues in my body where I have had multiple injuries over the years, and I do very well with something like Pilates. So, when you have somebody who has multiple injuries and they're coming in with changing symptoms all the time, and it's not, at the end of the day, it's about impaired motor function, right? And how do you actually improve that or improve motor control? So proprioception and your basics, your basic definition is your body's ability to sense movement, right? Action and location, and it's present in every muscle movement that you have. And over the years, people have resorted to, as I mentioned, Bosu ball, Swiss ball, things like that. I believe that knowledge is outdated, and I think that in try to give somebody a better sense of motor control, or as we say, you want to increase some somatosensory proprioception, it's somatosensory stimulation. And how do you do that? You actually do that with resistance, right? I have a patient now I'm treating chronic injuries, has Ehlers-Danlos syndrome, and these people love to stretch, right? Stretching is great. I feel great. It's the last thing that's going to help, right? So these people need input to their nervous system in the guise of, for example, closed chain resistance, hands and knees, going on the wall, doing a wall push-up, even doing hands and knees and just doing an arm and a leg off, having someone do like a down dog. You need all like 4 points of resistance to start with these people, because that will engage certain muscles, hopefully optimally, in trying to increase their sense of movement, increase their sense of balance, increase their sense of neuromuscular balance, I should say. And you want to start to increase the load with these patients, okay? So you can use therabands, you can do closed chain, you can use a TRX machine, a TRX, and they need input from something, okay? Not many people perform on a moving surface, right? Unless you are a surfer or unless you're in Cirque du Soleil, right? So those moving surfaces, as I mentioned, like the Bosu ball, have their place, but I don't believe they're the best way to increase proprioception. You need to increase the load, and you need to put weight and resistance to stimulate the patient's nervous system to optimize their neuromuscular balance, okay? And does that actually correlate to increased performance, right? And it does. There's many studies out there, especially in the sporting world, where they talk about, functional movement. And is functional movement proprioception? It depends. It depends on how you define it. But in terms of patients that I see who are super hypermobile, some have Ehlers-Danlos. They just don't do well without resistance. It's almost like you want to start giving them an isometric. Okay, so closed chain, as I said, is where I would usually start. And I also would have them on their hands and knees, just depending on what they're coming in to see me for, with a TheraBand wrapped around their arms, because you need to start with all 4 points of contact, in my opinion. As I said, the TRX is great for as a progression, and also just you need to start to load these people. It's not like you're going to, tell them to run to do, CrossFit, right? I do have a patient now who's super hypermobile and does CrossFit, and she does well with that, right? Because it gives her enough stimulus to her nervous system so she can work and move more optimally, right? There's been a lot of studies out there that have involved your non-athletic and recreational populations as well, and not so much of, your elite athletes. It's well known that they do well with a lot of this sort of loading type of progression, right? But not all of us treat elite athletes. We treat our recreational population, and I would say that a lot of this application, these principles, still apply, and it will carry over to injury management. At the end of the day, it's about injury management, and you can train, someone standing on a dynadisc and doing upper body work. And I used to do that years ago, but I don't do that anymore because I don't think that is the best use of their time. They need to be loaded in a way that will turn on their system. And everybody is different in that regard. You'd have to check and you'd have to have them perform certain movements. So a couple of other things that I would actually do is, not everybody can do a push-up, right? So I have access to Pilates equipment. So if any of our listeners do, I would certainly have them get on the, on the reformer and just have them do something like a knee stretch or any sort of closed chain work on the reformer. I have access to a core line. The core line has a great way to improve proprioception. They can kneel at the bottom of the core line machine and then put their hands on the pedals, and you can just do a lot of great closed chain work there. That's a great way to increase proprioception. If your patient doesn't have access to that or you don't have access to that, have them go on all fours, put pillowcases under their hands and their legs, and have them sort of move their limbs on the floor in that way, and that will really increase proprioception while stimulating movement control. Okay. I think another great way to do that is, for example, you can have them have different color therabands, or the same TheraBand wrapped around, below their. I have somebody I'm doing this with now, and she's in a squat position, and she's got a TheraBand, probably a red or a yellow, maybe a green at most, below her knees, sort of in between her knees and her ankles, and then I've got one above her knees, so she's got like 2 TheraBands around her legs. And then I've got her with a TheraBand wrapped around her, on her forearm. And then you can stop there and just have her do basic squats with arm lifts. So she's got 3 TheraBand, 3 points of contact. This is open chain, but she's pushing out against resistance. You can put a sports cord, wrap another TheraBand around her, you're behind her, and you're trying to pull her back. So then she starts to activate the anterior chain in the core. And you could go vice versa, you stand in front of her and you could have, she provide a stimulus going backwards, right? So you can stand in front of her or behind her and wrap the sports cord or TheraBand around, stimulating more of her trunk. So she's got the trunk, the arms, and 2 points of contact at her legs. That's a great way for people who are super hypermobile to start to really increase their proprioception. And I actually love doing that. People think I'm nuts sometimes. I've got them wrapped around like 4 TheraBands. And then what you can also do, which I love to do as the patients get more advanced, start to train velocity. That's a really great way of training proprioception. I used to have season tickets to the Knicks, and I used to see this a lot on the court pre-warm-up. They would just do mostly internal, external rotation with a heavy TheraBand, very high velocity, right? That's a great way to sort of warm up and train proprioception. You can do that. You can have them do, increased speed of reps, or you can just have them do more arm movement, internal, external, very quickly. So that's a great way to progress. And I do believe that in this population, especially the super hypermobile patients and the patients who do warrant more proprioception, they do need some stimulus in the guise of resistance, increased load, or increased in this patient TheraBand around multiple regions of her body. And it's a terrific environment for rehab and to increase proprioception. And you can certainly progress from there. I mean, and ultimately, if you do want to have these patients on a Bosu ball, just have them on a Bosu ball with, TheraBand wrapped around them. We'll have them load their system first, right? Versus just standing there with no input at all. So that's sort of my opinions. It's a very short, brief episode on this, but I thought that it's something I've come across lately, and I just wanted to do a short episode and would love everybody's thoughts and hope you enjoyed it. Thanks, guys.